Welcome to America's Heroes Group.
Welcome back to America's Heroes Group Roundtable with partner Chicago Regional Office, Veteran Benefit Administration. Today is Saturday, July 10th, 2021. And our host is Cliff Kelly, the governor of Talk Radio. I'm his co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith, and our digital media producer is the great Ivan Ortega, Scouts Honor Production, doing a wonderful job here for us. The panelists today, we have two great people we're going to be talking to. Ersellia Hubbard, who is a Chicago Regional Office Assistant Veteran, Readiness, and Employment Officer. So a very important person over at the VA. And we also have Crystal White, the VA Certified Rehabilitation Counselor. So these are two critical jobs for our veterans, and they are supporting them every day in their jobs. And so today, we actually are going to be discussing VRE Mental Health Counseling regarding the impact and challenges during and post-COVID-19. So I am so honored to have the both of you on, and to be talking about this important topic. So, Ersellia, what would you say to start off?
Well, to start off, I would just say it's an honor to service veterans and assist them after being so much going through the service and serving the country, and then we're able to provide services to them that will allow them to get over the hurdles that they may have incurred during their military service and helping them achieve employment that's going to be suitable and the right fit for their next phase in their lives.
Okay, fantastic. And then, Crystal, what's your opening comment?
I'd like to second that. I can't think of too many more rewarding positions to be in, and I'm also honored to be able to do that as well.
Fantastic. And then, for people who are out there, we have so many military acronyms and all that. What is VRE and what does that mean? So it's VRE Mental Health Counseling. Can you define that more?
Shall I take it?
Oh. Yeah, you can go ahead.
Go ahead. Go ahead. I'm sorry.
So VRE is Veteran Readiness and Employment.
Mm-hmm.
As far as the mental health prospect, in order to get into the program, a veteran has to have a service-connected disability in order to apply. And so we focus on the area of that disability and how it affects each individual specifically and what services may be applicable to them. So sometimes we may have to guide them to counseling at the VA hospital or other VA organizations like veteran centers. That just offers that extra support that even sometimes veterans don't realize they need, after thinking they're coming back the same way they left, and that not necessarily being so. Mm-hmm. So we focus on those aspects where they need that additional support.
Okay, so this is really going above and beyond just the general mental health services, right? Because now you're talking about COVID, and many of our veterans had post-traumatic stress disorder, or were dealing with other things like depression and other kinds of mental health issues. And then you have the family support mechanisms that are there. So the caregivers sometimes have, other issues that they encounter, especially during the COVID, pandemic. So, Ersellia, what do you think is the key issue right now with the pandemic? How has that changed the mental health landscape?
Well, I have to speak from a VRE perspective because we don't specifically, focus on mental health. Mm-hmm. We focus on every aspect. But as far as the mental health, one of the hardest things is, not having that face-to-face interaction. So, when you're online and strictly virtual and trying to meet with individuals, you don't have that feeling where you get to know them. On the computer, it's a different feeling. But I'll let Crystal speak more on that because she speaks more with the veterans directly, so maybe she can give more insight with it.
Okay, Crystal, great. What are your viewpoints?
Sure. And you asked as it pertains to the post-COVID environment, I think you said?
Yeah, so the COVID, how has that really transformed the mental health issues and how we contend with them, and especially, coming out of the pandemic? So we had issues we were dealing with during the initial phases of the pandemic, and by no means are we out of it yet. We have variants out there and all kinds of things going, and still people who are resisting becoming vaccinated, which is giving us additional issues to deal with. But during the pandemic, there was, pre-pandemic, they had mental health issues that we were contending with. And then during the pandemic, I can only imagine they intensified. We know that we had almost a 50% increase in, deaths due to opioid overdose. We had people who were, in situations where they were dealing with more intense issues surrounding depression. We even had some issues about domestic violence that may have escalated. So those kinds of things happened during the pandemic, and now in the post-pandemic period, as we're opening up, people still have, grief, that they're going through. They had, loved ones who passed away. They couldn't have funerals. They couldn't travel to see family members who passed away. They couldn't visit family members who were sick in the hospital. So there are a lot of emotional undertones here. So how do you think that this landscape is playing out, for our veterans? And what does the VRE Mental Health Counseling, has it transformed itself? Has it changed? And you were mentioning telemedicine or telemental health services, and that it may not be the same thing as, touching a patient, being in a room with them, telling them, you can see them and you can feel how they are. So how has that transformed things for us? What kind of world are we in now?
Sure. I would say I would say there definitely was some transformation, and there probably was some elevated mental health level of mental health distress due to the isolation, being on lockdown and all that. I would like to reiterate what Ersellia said, which is that, in VRE, it's the Veteran Readiness and Employment Program. We really do focus on, our services revolve around return to work. So there's a lot of vocational counseling, although we do provide some adjustment counseling. I would say we were making a lot of referrals to the VA Medical Center when it comes to the more mental health type of issues versus the career counseling. We do a lot of referring to the VA Mental Health Center, and they were really there and up to the task. They had their telecounseling, their telehealth, telecounseling set up, as well as the VRE. Our counseling services were also, we didn't skip a beat. We were already up and running and ready to provide counseling services via telecounseling. But I would say there definitely, was a need, a little bit more of a need to be referring folks to touch base with their therapists if they didn't have a therapist, to have them, to give them a referral to maybe establish some counseling over at the VA Medical Center, just for that extra needed support so that they can focus on the things they need to do to complete the goals of their vocational plan with VRE and, reach their employment goal.
Yeah, and a lot of people, right now we're trying to decide, and actually I'm in one of those businesses right now where people are trying to decide whether they're going to still continue to work from home or they're going to work in the workplace. People are, trying to decide whether they're going to go back to work. People are trying to find new jobs. Is this a challenge for you? Because with the vocational counseling, I can imagine you're dealing with a different kind of work environment that's out there now, and what kind of employees they're looking for. How has that impacted you? Has that changed the way you do things?
Do you want me to take this, Ersellia?
Yes, please.
Okay. I would say, I would say it wasn't as challenging as you might think, because again, we were already up and running in a remote environment. We were still open to the public pre-pandemic, but we also were providing services remotely already. So we were already up and running and established. We had just about everything set up, and a lot of the time, the veterans prefer to receive their services remotely as opposed to having to deal with traffic to get, to the VA location, to the regional office or the VA Medical Center. A lot of the veterans do prefer the telecounseling. In fact, I haven't had too many requests to come in and meet in person, even though now it is an option if they want to.
Okay. And so how does So give me an example of if I'm a veteran and I approach the VRE program. So Ersellia, how would I approach that program, and what can I expect? What would they do for me, or take me through sort of like a typical kind? And I know nothing is typical anymore these days. Everything is so individualized. But in general, what kind of things could I expect?
So typically, after the veteran applies, we'll set them up with the counselor, and the counselor will go over them, step by step, provide them orientation of the program, focus on their disabilities, and identify where the issues are or where their weaknesses are as far as entering the job market. Do they need an area of education, or have they had some education that would allow them to go into employment? Or in some cases, we've had much lower employment rates due to the pandemic because a lot of jobs or businesses have shut down. So that's affected the outcome, the end outcome in some aspects. So we have to focus on making sure that it's going to be a job that, regardless of if an issue like this occurs again, that they will be able to overcome that. So we're going step by step to address each issue and make sure that they're most employable once they complete the program, and that we've done all that we can do to assist the veterans.
Okay. Has it been any more difficult? I was mentioning some of the things that people are going through right now. They may have lost loved ones, family members as veterans, and if they had PTSD or if they had other things going on, prior to, entering the VRE program, do you see any special needs, that are above what you would see pre-pandemic, that, special areas that have changed a bit, or that you would like to see resourced in a different way?
To some extent, there's sometimes a greater amount of anxiety. People just worrying about, can they care for their families like they would need to, or, reserve that income. So there's been some increase somewhat in that aspect, just the overcoming the anxiety and things like that. So our job is to, on top of the education, we provide that security of income as well, because we do pay for education, and then they're able to get the BAH based on that. So that kind of alleviates some of those issues that come across.
Yeah, and do you have to, as a veteran, do you have to meet certain criteria to be able to apply for the VRE program? Or is it, how does someone, apply for it, and how are they viewed as far as being accepted into the program?
Well, like you spoke on before, that's the individual aspect. So the focus is, they have to have a service-connected disability of at least 10% or higher. And so we look at those disabilities and how they affect them going into employment. So it's more so based on, their discussion that they will have with the counselor during that orientation and entitlement process. And, say a veteran is 70% for PTSD and hasn't worked in 2 or 3 years or so, for whatever reason, we just look at all those factors and help them to the best of our ability. So applying is really simple. They would just go in to ebenefits.gov and put in the application and be set up to meet with the counselor.
Okay. And so ebenefits.gov. Is there any phone number or any other place they can call if they have more questions?
Yes, we have a direct line. Our number to our office is 312-980-4458.
4458. Okay. And you want to give that number one more time for those people listening?
Yes. 312-980-4458.
Okay, fantastic. So what kind of vocational rehab topics do you cover? I mean, there are so many different disciplines and types of work employment that are out there. What kind of things do you typically encounter in the veterans who are going into the work environment? Any special?
I'll take that one.
Oh yeah, sure.
I'm sorry.
Go ahead, Crystal.
If you don't mind. So the services provided are based on the veteran's occupational interest, aptitude, and abilities. Once they undergo the orientation, and then if they're found during the initial evaluation appointment to be entitled to a program of services, before that initial evaluation, they would have been asked to take a career assessment. And so we'll review the results of that career assessment in terms of what it has to say about the individual's occupational interest, aptitude, and abilities. We'll give them some career counseling and guidance on that. We'll show them how to research occupations further. We'll have them research a few. They'll do the research. We'll show them how to do the research, and they'll spend quite a bit of time researching different occupations. They'll look at different job postings that are current in the labor market right now, just so that they can make a really well-informed decision about what career would be a good match for them and also compatible with any issues that they have due to the effects of their disability condition.
Oh, fantastic. Because, one of the things that's in a general job market too, at many companies, they have, sort of a veterans hiring program. And what they try to do is to sort of match. And when you were talking, when you were saying based on their occupational interest, aptitudes, and abilities, I was thinking automatically of, your MOS designation. So what is your military occupational specialty, and how does that translate into the civilian world and into the private sector, as well as the public sector, because some people remain in the public sector after transitioning. So that's really interesting. Does a person necessarily, if they have a disability, do they have to follow the same occupational line they were in before, or is there some flexibility when people start considering other fields of work?
I mean, I would say it definitely lends to transferable skills if they do something that builds on that or relates to that. But a lot of the civilian sector doesn't as closely relate to what a veteran would have done in the world of, or in the military. Administrative, there's going to be a lot of transferable skills, and there's a lot of, leadership, things like that. There are a lot of skills that transfer, but there are a lot of ways in which the civilian sector is very different, and it is pretty flexible. Again, I wouldn't say that myself necessarily, I will take into, as a vocational rehabilitation counselor, I will take into consideration what they did and what they liked about that, what they didn't like about that. But, again, we're really kind of looking at the current situation and what is within their current interest, aptitude, and abilities, keeping in mind there is a certain number of months of benefit time that they're entitled to. So we want to build on whatever the veteran has brought to the table. A lot of veterans have completed some or all of a college degree while in the military. Mm-hmm. And so, we like to the best extent possible, build on what they have. But if what they have is not compatible, if their background, if what they did in the military simply isn't compatible now due to the impact of their disability conditions, and there aren't a lot of transferable skills, like, for instance, something physically strenuous where the veteran's no longer able to perform physically strenuous job functions, then we, might look at something that's pretty different than what they did in the military.
Yeah, Crystal, can you go into a little bit more about the, the time you were mentioning that they have a benefits or some time element that's associated with this? You were saying that they may have, certain amounts of time where they are covered, during this. Because I'm not sure what the actual time frame is for, the VRE program before someone, just starts the program and when they expect it to complete it, or is there an expectation of a certain time limit?
Okay. All services. Oh, I'm sorry. Did you ask Ersellia or me? I was disconnected and I didn't hear.
Oh, yes, Crystal. Yes, I was asking you about.
So sorry about that.
No, sure, because you mentioned the time. You had mentioned the time elements and that benefit time and that kind of thing. So, what's the expected time length of people being in the program? Once they start and have been accepted into it.
It really depends on what their needs are, what their occupational goal is, and what is needed to achieve the objectives of the goal. So, some folks, for instance, the IT field, they may be generally employable with an associate's degree and maybe some industry standard certifications. That is more of a short-term situation than a bachelor's degree. So their training program is going to be shorter than someone else who needs to have a longer period of a degree, like a bachelor's degree or even a graduate degree, to be generally employable in the field they identified as being suitable and compatible. So it really just depends. There is a little bit of flexibility if a veteran qualifies to maybe if they are just short of enough time to complete to complete the educational training they need to be generally employable. There might be the possibility of an extension of benefits if certain criteria are met.
Okay.
Yeah, and I want to add to that. I think Chris might have missed some of the questions. So generally, if somebody hasn't used any education benefits, they would start out with about 48 months of time.
Okay.
There's usually other education benefits that may be available to them, such as Post 9/11 or Montgomery GI Bill, and those are generally 36 months. So if they've used those types of benefits previously, we would have to consider that amount of time that they might have used towards a degree already. And in cases where somebody hasn't, they usually come into the door with 48 months, which usually is enough time, 4 years for a bachelor's degree, or maybe if they have a bachelor's degree, then they can apply some of that time for further education if it's deemed to be needed.
Oh, boy, I'm glad you said that because I was thinking of a much shorter time than 48 months. That's quite a bit of time, 4 years. And one other thing, Ersellia, since you were mentioning that, I was wondering, people come in with different levels of disability. So it could be 10%, it could be 50%, 90%, 100%, right? And then you have mental health disabilities and you have physical health disabilities. So I was thinking about, both are extremely important. But for the physical health disabilities, for people who've lost a limb, are there special services that are offered as well, to supplement what they're doing? Because you may have to work with a prosthetics team or some other avenue of, occupational therapy or training for people to be able to get employed. Or do you have any kind of linkage with that group, or how does that work?
That usually works through, we do have a program that focuses on independent living. So if it's affected them to the effect that maybe they can't go to work, then we do look at the independent living track and look at services that might assist them with being more independent just in the home or outside of the home or wherever the need may be. So the way that we usually do that is referring to the prosthetics team with the hospital side or whatever physician they're currently working with. If it's something to do with their vision, then we're looking at sending them to the vision clinic to assist them with those services. So whatever it may be, we'll refer them specifically to those experts, but we do try to help and, middleman and help through the process.
Okay, fantastic. We have about a minute and a half to go. And one of the things, and it's always too short because this is a great and valuable information for our veterans and their families, because you're not just helping a veteran when you're doing, your VRE mental health counseling and work and helping them to get back in the workplace. You're helping the entire family. And so, God bless you for what you're doing. And, I guess you were saying ebenefits.gov is where people should go, to find out about this and sign up. And also that number was 312-980-4458. But I'm going to start with you, Ersellia, and I want you to give a couple of comments. And then, Crystal, you can follow right after her. And this, any last words that you want to mention. Why is this program so important for our veterans and their families?
It's very important because, I know there's probably too many to count, but, if you can just hear some of the testimonies, some of the lives that we've helped and changed for the better, just some veterans, they come out and they just have no idea what they're going to do. Their frustration level can, just be outrageous sometimes, and we want to be that support that they need. So our focus is that, we kind of help keep that frustration down and that the anxiety down and help them just return to life as normally as possible, because sometimes there is a lingering effect that does affect the whole family. So whatever
Yes.
we can do in that process, if there's any veterans that out there that feels like, they have no idea what to do and they can't hold a job, then VRE is available.
Okay, and we have about 10 seconds. So, Crystal, go ahead and say something, about that. What do you think?
Sure. It's about helping veterans to earn a living. And obviously that's very important for both them, their families, and also for the community that they live in. It's an invaluable program.
So thank you so much, Chicago Regional Office of Veteran Benefits Administration. We have two incredible people talking to you. Ersellia Hubbard, who is a Chicago Regional Office Assistant Veteran Readiness and Employment Officer, as well as Crystal White, who is a VA Certified Rehabilitation Counselor. Thank you for your service to our veterans and to our nation and to the families that are here that have to suffer the slings and arrows of war, and our injured veterans who are coming back, both in the mental health dimension and the physical dimension. So thank you for strengthening our society. We have got to have you back because this is such an ongoing problem coming out of the COVID-19. So stay with us. We were honored to have the two of them on this call, and I want you to know that we have two exciting shows to come up.